The Centers for Disease Control and Prevention in the United States has identified two distinct strains of monkeypox in the country. According to health officials, genetic analysis of recent cases suggests the virus may have been circulating undetected for weeks. There could also be community transmission happening in parts of the U.S. where the virus has not yet been identified. The CDC says it's stepping up its efforts to find infections and that more cases will likely be reported. There are at least 20 confirmed cases of monkeypox in the U.S. Canada has confirmed 77 cases here. For more, we're joined now by Dr. Christopher Labos. He's an epidemiologist and cardiologist joining us in Montreal. Always good to see you. Thanks for the time, Doctor.
My pleasure. Thank you for having me.
So we now know, people won't be thrilled to hear this, I'm guessing, there are two main strains of monkeypox, the Congo strain, the less severe West African strain, which is the one believed to be circulating here. So now the CDC saying they've detected two distinct strains in the U.S. So what more do you know about this?
Well, what they've done is they've genetically analyzed the samples that they have in the United States. And while all of the samples that they analyzed were very similar to each other, they were significantly enough different from the dominant strains that are circulating in places like Europe. So that suggests that we don't have one monkeypox outbreak going on in the world right now. We have multiple outbreaks that just happen to be going on at the same time. And that suggests that this virus, rather than sort of escaping from, Western Africa once and then causing this global event, there's actually been multiple escapes. And that would suggest that, again, number one, that this virus is circulating fairly widely in Western Africa, but also that we should expect things like this to keep happening, because if the virus can escape multiple times within a short period of time, it suggests that it could continue to do so. And so we have to not just control monkeypox where we are here in North America, but we also have to control it at the source, which means making sure that we can implement public health measures in Central and Western Africa, where most of the cases of monkeypox globally happen to reside.
You're using the word escape. What exactly do you mean by that? And are we looking at a case where they're mutating, or these are just original strains that are being detected now?
So they're not mutating in the same way that we were worried about COVID sort of developing new variants that were becoming more infectious. What happened prior to this, most cases of monkeypox were actually confined within a fairly small geographic area. We didn't see monkeypox very often in Europe and North America. The last big outbreak was in 2003 in the US. And while there were isolated cases here and there, they were usually linked to travel and they didn't end up causing human infection. The question becomes, why is this happening now? And the reality is that when you look back, cases of monkeypox were actually rising in Central and Western Africa, even prior to COVID. We just didn't notice. So we may be seeing the consequence of that now. So when we talk about escape, what you're talking about is cases confined not just to Central and Western Africa, but also parts of the Middle East, and now it looks like parts of Europe, parts of North America. So you have this sustained transmission, not just in Africa, but globally, and that means that our public health measures have to be applied, in fact, globally, any place where you're seeing lots of cases happening.
Well, how worrisome is the news of the two distinct strains, in your opinion, when it comes to this country?
I don't think that it's worrisome per se. I think it highlights the fact that this is a problem we can't ignore. And this is a problem that we have to, even if we are able to contain all the cases we have here in Canada, right, and we eventually get down to 0 cases of monkeypox, which is still a plausible outcome. But even if we do that, we can't then forget that monkeypox exists. We have to go and deal with it at the source. And whether that means vaccinating people in Central and Western Africa or pouring more resources to help contain the virus there, we have to do something. Because if we don't do it, I think what this data is proving to us is that future outbreaks could still happen, especially given that most people have not been inoculated against smallpox now because we eradicated it and we stopped giving out that particular vaccine.
Well, certainly we have all learned a lot about preventing the spread of viruses over the last few years. So another question for you before we let you go about some COVID news. CBC has learned that Ottawa is moving toward ending the distribution of COVID-19 rapid tests by the end of 2022. Do you think this is a good idea?
I think it's a potentially problematic idea because if number one, you don't have access to PCR testing, and now number two, you don't have access to rapid tests, well, how are you going to diagnose people with COVID? There's an old joke in medicine that if you don't take a temperature, you can't find the fever. It's like, well, if we don't test anybody for COVID, then, well, we won't see any COVID cases. And, everybody's going to be very excited about how COVID cases are now at zero, right up until the point when the hospitals fill up with COVID patients and it's now too late to stop that train. So I understand why the government is doing this. There is obviously an expense to buying all these rapid tests, and that puts a significant drain on resources. But we need to have at least some stockpile or some mechanism for ramping testing back up again, because while things are fine now, they may not be fine again in the fall. Remember, in the summer of 2021, everything was fine. Everybody was happy. All COVID measures were starting to get lifted. And then we had a resurgence because of the Omicron variant. So we should learn from our past mistakes. And it's fine to downscale things now as long as we have a plan to upscale things if, COVID has a resurgence in the fall.
All right. Always great to get your insights. Dr. Christopher Labos in Montreal. Thanks.